You had a trigger finger release surgery and your fingers are really stiff, but you weren't given any direction on what to do except for maybe wiggle your fingers or just make a fist. Sure, that can help a little bit, but there are some very important foundational exercises that can increase your range of motion more comfortably and get you using your hand faster. Hi guys, I'm Michelle from Virtual Hand Care, and I'm an occupational therapist and a certified hand therapist of 20 years. And in this video, I'm sharing 6 beginner trigger finger release exercises to help decrease your finger stiffness and improve your overall finger range of motion after hand surgery. But of course, quick disclaimer, this video is not a substitute for medical advice. So always ask your doctor or your certified hand therapist with questions about your condition. Now, as we move through these exercises, just start out very gently. Some of you may still have some stitches in your hand, and you might feel some mild discomfort with some of these exercises, but never push beyond a 2 to 3 out of 10 pain level. Okay, let's start with exercise 1. This one is finger spreads. So you can do this one up in the air, or I really like to do this one with the hand flat, palm down on a table or on a towel. Just be careful that if you do have stitches that you use a surface that feels comfortable on those stitches. So go ahead and place your hand palm down, and you're gonna go ahead and spread those fingers apart as far as you can. And then you're going to bring those fingers together. Now this works on keeping the finger straight. So you wanna make sure you're trying to get as much extension as possible, because after hand surgery, sometimes our fingers wanna curl down and getting them straight can be difficult. But this also works on opening up the web spaces between our fingers, which is really important for finger dexterity and coordination. So let's go ahead and do about 10 of those finger spreads. Ready? So go ahead and spread the fingers apart, really working on opening the web spaces, but also making sure that the hand is flat and you're keeping that extension. And then bring them together. That's 1. Spread open. And together, that's 2. And spread apart. And together, that's 3, and spread. Just go as far as you can. And together, that's 4, and spread. Just make sure you're not pressing down into the table. That can be a little bit uncomfortable. And together, that's 5, and spread apart. And together, that's 6, and spread. And together, that's 7, and spread apart. And together, that's 8. 2 more, spread those fingers apart. Hold just a few seconds. Come back together, that's 9, and again, last one, spread, and together, and that's 10. Okay, exercise 2 is passive finger lifts. So this is gonna continue to work on finger extension. It's gonna work on PIP extension, which is that middle joint that sometimes kind of wants to get stiff and bend, but also at the knuckle, working on lifting that knuckle back so you can get full finger extension. So again, you're gonna lay your hand flat. Just make sure your palm's nice and comfortable if you do have those stitches in, and you're gonna use your other hand to lift the finger. So I'm gonna show you on my middle finger. So you're gonna go ahead and use the thumb and index finger of your other hand, and you're gonna go ahead and place that thumb on top of that middle joint. Press down just slightly with your thumb as you lift the tip of the finger up off the table. Then what you wanna do is continue that lift, and then you're gonna go ahead and get a little more knuckles extension or MP extension. So you're just lifting up just a little bit, really as much as what is comfortable for you. You don't need to go and just take this and go into too much extension. That's probably pretty uncomfortable for you right now. Even if you can lift it the tiniest bit off the table, that's okay too. Just do what you can. So let's go ahead and lift the tip of the finger up and then continue that extension by stretching the whole entire finger at the MP joint too, holding here just a few seconds and then relaxing back down. And that's 1. And again, lift up and continue that lift, making sure you get some good extension through all 3 of those joints of that finger. And hold. And relax back down. That's 2. Again, press down with the thumb, lift the tip of the finger, kind of getting a little counter force pressure here, and then continue that extension. Hold. And relax down. That's 3. Let's continue with that. Lift up, making sure you're getting that PIP extension, then go into that MP extension or those large knuckles. And relax, and that's 4. Again, lift up into extension, and then nice and lightly continue that whole finger extension. And relax back down. That's 5. You're halfway there. Let's continue with that. Press down with that thumb. Lift up the tip of the finger off the table. Hold. And relax back down. That's 6. And again, lift back up. Relax back down. That's 7. And again, lift and continue that lift. Hold. And relax back down. That's 8. Let's do 2 more. By now, hopefully your finger's feeling like it can get a little straighter. If not, that's okay. Just keep going. Lift the tip off the table. Then continue that extension. Hold. And relax. That's 9. Let's do 1 more. Lift and lift. You're getting extension in all 3 joints of that finger. And relax back down, and that's 10. Good job. Okay, now let's go into exercise 3. This one is DIP blocking. So now we are gonna turn our attention to work on finger flexion, but it's important to work on each joint by itself before we go from working on extension to all of a sudden trying to make a fist. So to do that exercise, you're gonna use your other hand and you're gonna place your thumb right below the tip of your finger here. And again, I'm gonna show you on my middle finger. So you wanna make sure that you block all the joints except for this DIP joint, the tip of the finger. And then you wanna actively bend the tip of the finger and then straighten. Now this works the FDP tendon, which is that long tendon that was responsible for trigger finger. So we wanna make sure we get that to glide through that surgical site nice and gently. So let's go ahead and do 10 of those. Ready? Actively bend that tip of the finger and straighten. That's 1. And down and straighten. That's 2. Bend and straighten. That's 3. Bend and straighten. That's 4. And if your other fingers want to bend too, that's okay. Bend and straighten. That's 5. Bend and straighten. 6. Flex. Extend. 7. Bend and straighten. 8. Bend. Straighten. 9. Bend and straighten, and that's 10. All right, now let's go into exercise 4, and we're gonna work on that next joint. That's our PIP joint. So go ahead and slide your thumb down, and now we are gonna go ahead and bend and straighten at that middle joint. Ready? So bend and straighten, that's 1. And again, if our other fingers bend, that's okay. Bend and straighten, that's 2. Bend and straighten, 3. Bend and straighten, 4. Bend, just do what you can if you can't bend too far for right now. And straighten, that's 5. Halfway there, down, straighten, 6. Flex and extend. Make sure you extend all the way up to 7. Bend as much as you can and straighten as much as you can. That's 8. And bend and straighten. That's 9. And bend and straighten, and that's 10. Good job. Okay, these last 2 exercises are different versions of tendon glides. So these are gonna be a little bit of combined movements. We're gonna work on going into finger flexion as well as extension. So exercise 5 is knuckle benders to straight fist. So go ahead and prop up on your elbow. You're gonna work on straightening those fingers, especially that finger that had the surgery. Try to straighten as much as you can. And you can go ahead and use your other hand just to kind of support the palm or the wrist if you want. And then you're gonna bend at those knuckles only, trying to keep the rest of the finger joints straight. And then you're going to go ahead and bend at those middle joints while you're trying to keep the tips of the fingers straight. So this is called a straight fist. When you don't curl the tips, but you keep them straight, that's called a straight fist. And then you're gonna go back up to those knuckle benders and straight. Now just do what you can. If you can't go that far or do that whole entire tendon glide, that's okay. Just do what you can. Ready? So go ahead and bend at the knuckles into that straight fist, just to what you can do. Back up to knuckle benders and straight. And that's 1. Back down, straight fist. Back up to knuckle benders and straight as far as you can. That's 2. Bend those knuckles, straight fist. Back up to knuckle benders and straight. That's 3. Knuckle benders, straight fist. Knuckle benders and straight. That's 4. Back down to the bending those large knuckles, those MP joints. Then bend those PIP joints into that straight fist. Back up into knuckle benders and straight. And that's 5. We're halfway there. Bend the knuckles to straight fist. Back to knuckle benders and up, as much extension as you can. And that's 6. Come back down, bend those knuckles. And then into that straight fist. Back up to the knuckles, knuckle bending or MP flexion, and straight. And that's 7. MP flexion. Then PIP flexion. Back up into that MP flexion and straight. And that's 8. Let's do 2 more. Bend those large knuckles, just what you can do. Then try to bend those PIP joints, those middle joints, while trying to keep the DIPs straight if you can. Back up into knuckle benders and straight. That's 9. Let's do one more. Bend. Bend those PIPs. Back up to those knuckle benders. And straight. And that's 10. Good job. Okay, now we are on our last exercise, exercise number 6. This is another version of a tendon glide. This is hook fist to full fist. So to do this one, you're gonna start in as much extension as you can with the fingers. Then what you wanna do is try to flex into what's called a hook fist. So those large knuckles stay straight, but you're bending those two little joints, the DIP and the PIP joint of our fingers. And your thumb can bend too, that's perfectly fine. It might feel a little stiff too. And then you want to go ahead from there, continue by curling those large knuckles and try to curl into that full fist. You do not need to make a really tight fist right now. You probably can't yet without it being pretty uncomfortable. So just really work on just curling nice and lightly just to get that range of motion. Just making sure all 3 joints are curling. Then you want to go back up into that hook fist and straight. Let's do 10 of those. Ready? So full extension. Try to come down into that hook fist, really trying to keep the knuckles straight. And then go ahead and bend those knuckles, trying to make that full fist if you can. Then back up into that hook and straight. And that's 1. Back to that hook. Curl into that fist. Back up into that hook and straight. And that's 2. So hook, fist, hook, straight. That's 3. Again, just do what you can. Hook, fist, hook, straight. That's 4. Hook or flaxing, making sure you're keeping the knuckles straight. Continue that curl by bending those knuckles into that fist as much as you can. Back up into that hook and straight. And that's 5. You're halfway there. Hook, curl into that fist, back up into that hook, and straighten out. And that's 6. Go ahead and go into that hook, and fist, and hook, and straighten as much as you can. That's 7. Let's keep going. Do that hook fist, full fist, back to the hook fist, and finger extension. That's 8. Let's do 2 more. Hook, fist, hook, straight. That's 9. 1 more. Go ahead and curl into that hook. Hopefully by now you're seeing a little more flexion in those joints. Continue that curl down. You might not be able to curl all the way in your palm. Maybe it looks like it's out here. That's okay. Just do what you can. Go ahead and go back up into that hook. Making sure the knuckles are as straight as possible. And straighten up those fingers as much as you can. And that's 10. Good job. And there you have just completed 6 trigger finger release exercises. Hopefully your finger stiffness has decreased quite a bit and you're noticing more finger range of motion. Now, it's not uncommon to have stiffness for several weeks, even months sometimes after a hand surgery. So make it a habit to do these exercises 2 to 3 times a day until they become easy. If you found this video helpful, do please give it a like and don't forget to hit that subscribe button below. And when you're ready for hand strengthening exercises, check out more of my videos here. Until next time, thanks for watching.